The 4 steps to cure high blood pressure. The World Health Organization claims that 1/3 of all adults has elevated blood pressure, and that 9 out of 10 of us, as we age, will eventually have high blood pressure. In this video, we will be sharing the 4 major issues that those with high blood pressure should first focus on if you need a cure. Surprisingly, conventional medical professional states that 90% of all cases of high blood pressure have no known cause, and label this disease essential hypertension. Just imagine this situation: billions of people worldwide have been diagnosed with a very puzzling killer disease. Doctors declare the condition incurable, and insist that their patients must take medication indefinitely. We believe that high blood pressure is not a disease by itself, but rather a symptom with known causes. We should address the underlying causes, and not just treat the numbers on the blood pressure machine, as is traditional. There are many lifestyle factors associated with high blood pressure, but unfortunately, the emphasis is on managing the problem with drugs. Many of these lifestyle issues can be corrected, resulting in a lowering of the blood pressure. Number 1. Nutrition. Most hypertensives have an imbalanced diet, and do not eat enough vegetables and fruits, while consuming too much processed food. This results in a lack of many vitamins and minerals, such as magnesium, calcium, and potassium, while consuming excess of others like sodium. This can most definitely raise your blood pressure. A healthy diet, with the combination of vitamins B, C, E, and D, and minerals like magnesium and potassium, along with the omega-3 fatty acids, and herbs like garlic and hawthorn berry, can be of great use. In addition to diet, juicing fresh organic vegetables and fruits such as beet, kale, cucumbers, cantaloupe, celery, carrots, apples, papaya, and pineapples are greatly beneficial. The relationship between obesity and high blood pressure is very well known. No overweight or obese individual with high blood pressure should be taking blood pressure medication without also being on a structured weight loss program. The cellular nutrition program is extremely effective for correcting obesity. What about salt? Detailed research published in the American Journal of Hypertension found little evidence that by just cutting salt intake reduces blood pressure problems. Less than 15% of people with high blood pressure are salt sensitive. Rather than severely reducing your sodium intake, one should create a healthy balance between magnesium, potassium, and sodium in your food. Most hypertensives are magnesium deficient, rather than overfill with sodium. Use sea salt moderately. The lower your vitamin D levels are, the greater the risk is for you to develop high blood pressure. Therefore, a daily sunbath, or a vitamin D supplement, could be the missing link in your hypertension correction program. Number 2. Exercise. What do accountants, office workers, computer programmers, artists, and drivers have in common? They are like many of us, though dedicated and hard-working, sit a lot and develop an increased risk of high blood pressure. South Korean researchers found that office workers who spent long hours at their desks had a greater risk of developing hypertension. Working more than 60 hours per week doubled the risk of high blood pressure, compared to working less than 52 hours. Australian research suggests that more than 4 hours of sitting per day increases your risk of high blood pressure. If you work 8 hours per day, for 5 days a week, enjoy watching television, or using your computer at home, you may be sitting for almost 100 hours per week. Fortunately, a little daily exercise, even 15 minutes, 3 or 4 times per week, can help lower your blood pressure. If you are liking the video, then go ahead and give it a thumbs up. Number 3. Stress management. Stress, whether emotional, physical, or environmental, often contributes to high blood pressure. Sometimes, the stress originated way back in your childhood days, and may be now buried deep in your subconscious mind. In addition to identifying your stressors, it is important to modify how you respond to them. Learn to relax for even a few minutes each day, to allow your body to reset itself to a lower normal blood pressure. Yes, you can use relaxation to lower your blood pressure. There are several other powerful mind-body exercises that help lower blood pressure. If you know of any other powerful mind-body exercises that can help lower blood pressure, feel free to share it in the comments. Enough good quality sleep is also vital and will have a positive effect on your blood pressure, as it is during sleep that your body heals and repairs itself. Number 4. Detoxify. Several polluting chemicals in our modern environment, damage our circulation and elevate blood pressure. Detoxification techniques play a very important part in the hypertension cure. These include chelation therapy, infrared sauna baths, and colon hydrotherapy. We are not suggesting that you should not take your medications, but be cautious with drugs. The list of drugs for high blood pressure is very long, and research has shown that which drug a doctor prescribes is influenced more by drug company propaganda than by scientific rationale. A big study to compare the effectiveness of different high blood pressure medications was published in 2002. It reported that cheaper and older drugs were often more effective than some of the newer expensive drugs to lower high blood pressure. There are many side effects found in blood pressure medications. Some, like erectile dysfunction, are well known, but others, like increased cancer risk, have been kept secret. Finally, check your medicine cabinet, as many other drugs increases blood pressure as a side effect. These includes antidepressants, birth control drugs, steroids, anti-inflammatory painkillers, and decongestants. Cold, flu and sinus medicines are a few common examples. Therefore, by following these 4 simple steps, you should be able to cure your high blood pressure and be medication-free. Bear in mind that this is for educational purposes, so you must always speak with your doctor before making any decisions. If you want to see more videos, subscribe to the channel, and share it with your friends. If you like the video, give it a thumbs up. If you have any questions or comments, leave it in the comment section below. Thank you for watching.